Good morning. This morning, I am going to perform the surgical hand washing procedure. So, this is performed in the OR or surgical procedure for a couple of reasons. First, it helps reduce the number of transient and resident microflora and prevent any hospital acquired or delivery infection for delivering of a mother. So, we need first to remember that we will wear a 2 inches above our elbow. So if we are having a long skirt, we need just to put it in our shoulder. And we need to prepare our materials. So we will prepare a sponge, a nail pick, and especially a hand washing or solution in the hospital. So let's go. What we're going to do is to wet our hands. And the first step is we will use our nail pick. So we will apply this nail pick on both our hands. The other side. And we will throw it in a plastic bag or any container. So remember that we should avoid our hands touching any object from unsterile field. So if case that our sponge or anything would touch and will fall, it's either we will ask another person to assist us to give us another sponge, or we will start another one. So the second step is we will brush our nails 30 times. Okay? And we'll do this the same hands 30 times. The next step is we will wash our fingers. So we will divide the fingers in the 4 different parts. So we will stroke each 10 times. So each side 10 times. First, 1. Other side. Other side. So you can notice that we are turning our hands while we are changing our sides. And don't forget to stroke and brush the wedge 10 times. The wedge. And the wedge. And after the finger, now we will divide our hands in, guess what? 4 sides. And we will have a circular motion 10 times. So again. We will apply the patience of a nurse here. By the way, before we would forget, we need to ensure that our dress is at least above 2 inches above our elbow. So it would not need to touch our elbow, okay? So if we're having a long skirt, we'll just pull our skirts above it. So after the hands, we will now apply in our arm. So we will just divide our arm in 3 parts. So we will not make a very big circle or strokes. So 4 equal sides, and we'll part it in 3 parts. Okay? So first part. The other side. The other side. The other side. And the other side. And second part. 10 strokes. Circular motion. This side. And the last part. Remember that we are using the sponge to avoid shell shedding. Once again, be careful not to touch anything of the sterile area. So after doing the left hand, we will do the same in the right hand. So we are now finished with the fingers. We'll proceed with our fingers. And the wedge. And the wedge. And the wedge. Then our palms, our hands. Then circular motion. With the arm. Part. After that, we'll throw our sponge. Just throw here, or we will have a plastic bag. So, and now, we will now go to the rinsing part. So, it is very important to take note of this. In rinsing, we will just having a one stroke, no back and forth. Okay? So, we will have a one stroke, no back and forth. So, no back and forth. So, just giving an uppercut. Then the other side. Remember that we should always make sure that our hands are above our elbow, because we need to prevent that the water coming from elbow will contaminate our hands. And we'll always put our hands above our shoulder and above especially our waist. So thank you so much.